Have you ever wondered how to maintain good vision at every stage of life, from childhood through to your golden years? Eye health is something we often take for granted, but it's crucial to maintaining quality of life. In this video, I'll be talking to one of Melbourne's most experienced optometrists, Minh Van Tran, who has been the owner and principal optometrist at VisionPro in inner West Melbourne since 2008. We'll discuss essential eye care tips for both young and old, exploring everything from managing diabetic eye conditions to why your child might need an eye exam before starting school. And we'll even delve into the benefits of good quality eyewear. But first of all, who am I? My name's Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that helps independent optometrists to grow their practice. So, hello, Min. Thank you for making time for this interview.
Hi, Paul. Thank you for having me.
Thank you. Well, to get us started, can you give us a quick 60-second backstory of who you are and how VisionPro came about?
Oh, yeah, sure. Well, my name is Minh Van Tran. I'm an optometrist. I've been an optometrist since 2000. So I've been practicing for quite a long time. We started VisionPro Optometrist in 2007 in Footscray and in St. Albans in 2011. So we at the two location we see a lot of patients who are from the Asian background, predominantly Vietnamese. So our patients come from a family sort of setting. So got the grandparents, the parents, and then the children. So we cater for all ages, and we find it quite rewarding to sort of service people from sort of ethnic background who English is limited. So yeah. So we can help them out in that respect. So a lot of time we do the testing, the consultation in Vietnamese, and explain things in Vietnamese where they might not understand it if it was in English.
Sure. Great. Okay. Well, that sounds like a really great service then you're providing for the local community there. So I mentioned that this interview would be focused on eye care and eyewear for young and old. So let's start by talking about a couple of eye health conditions that unfortunately tend to be more prevalent among our senior citizens. I'm talking about diabetic retinopathy and cataracts. So let's start with diabetic retinopathy. So what is it, and who does it affect? Can you tell us a little about that?
So diabetic retinopathy is a condition that affects people who have perhaps severe or uncontrolled diabetes. Diabetes affects the blood and the blood vessels, especially the smaller blood vessels in our bodies. We have a lot of those smaller blood vessels in the back of our eyes, in the retina. So in the cases of people with diabetes, the vessels tend to be quite leaky, if you like. Hence, we get bleeding, so the blood sort of seep out of the vessels into the surrounding environment. And when that happens, we get bleeding in the back of the eye, and that can have very severe consequences to a person's vision. So we need to monitor for any retinopathy and sort of prevent or start treatment in time to prevent vision loss or further vision loss.
Okay, so anyone who knows that they have diabetes, then how often should they get their eyes checked, and what can they expect during a diabetic eye exam? How do you conduct those types of exams?
If you have diabetes, then it's recommended that you get your eye tests annually. Now your GP will remind you of that. Most GPs will refer their patient for an eye examination if the patient have diabetes. We get a lot of referrals from the GPs in our area. So an eye examination is a full eye examination. So we do vision checks, we measure your prescriptions, we check the front of the eye, the anterior eye, we measure eye pressure, and then we do a very thorough check of the back of the eye, so the interior of the eyes, in what we call a dilated fundus examination. So we insert some drops in your eyes to dilate your pupils, and then we have a very good look at the back of the eye in the retina, and we take photos to make sure that if any retinopathy is present, we can detect them.
So diabetes is something I think is becoming more and more common in Australian society, isn't it? And
Yeah,
so
certainly.
Something that we're hearing more and more about, I think.
I'm glad you asked the question, because you know, I've been practicing for a very long time, for more than 20 years. We used to see diabetes in sort of, you know, older patients in the 60s, 70s. But in the last few years, we have received referrals from GPs for patients who are in their 40s, and we're increasingly seeing that. So it's quite a concern, you know, to see people who get diabetes at quite a young age. So those people need, you know, regular eye tests, like I mentioned, annually, just to make sure that they don't develop retinopathy, because yeah, it can have quite severe consequences on their vision and their general health in general, because you don't get retinopathy unless your diabetes is quite severe and uncontrolled. Yeah.
Diabetes is one of those diseases with lots of adverse consequences, isn't it? And I guess it's a lifestyle related disease. So are there any things that like people can do about changing their everyday habits in order to reduce the risk of uncontrolled diabetes and diabetic retinopathy?
I guess it's obvious that you need to have a, you know, a healthy lifestyle. That's what I keep telling my patients at the end of the consultation. You know, when I get asked, how do I prevent the diabetes from affecting my vision? I said, well, the effect on the eyes come from actual diabetes. So we have to control the diabetes, and that involves just, you know, living a healthy lifestyle, having a healthy diet, healthy food, lots of exercise, and sort of working with your GP to control your diabetes. If you need medications or insulins, for example, and just be compliant with those treatments. That's what I tell my patients. Yes.
All right. Well, I said that we're going to focus on a couple of eye health problems that are you know, quite common. So diabetes or diabetic retinopathy, one of them, and the other one I'd like to ask you about is cataracts. So this is kind of a personal topic for me, because I've got some elderly family members now who need to be treated for cataracts, and it's a word that we hear a lot about, but I think a lot of people would like to know really more about what are cataracts, and what are the first signs of cataracts that people should be aware of that would lead them to consider getting an eye test with an optometrist if they're not already.
Well, cataract is basically just the degeneration or the aging of the natural lens in our eyes. So when we're young, the lens in our eyes is crystal clear. So it's sort of like looking through a brand new window. You can see your garden outside quite clear. As you get older, your lens ages and it becomes cloudy. So it's like your window is getting dirty and dirty and dirty. So the effect is you're not getting a clear vision through the window or through your lens anymore. It feels like, you know, something dirty is in your eyes, and people try to clean it, but it doesn't go away. That's what they tell me when they come in with cataracts. You know, it's like something's in my eyes, but I can't clean it. And it affects your vision, of course, but it increases your sensitivity to glare, especially when you're driving at night. You know, the headlights on an oncoming car really bother you. And sunny days, yeah, you wouldn't be outside very long if you don't have a good pair of sunglasses on. So yeah, that's what cataract is all about. Yes.
So do you have any advice about how to delay the onset of cataracts? Like you said, it's very, like, it's related to the aging process. And I've heard some people say that that eventually, you know, we're probably all like they have cataracts, but is there something that you can do to kind of slow down the process?
Yes. And I guess it's it's go back to that, you know, healthy lifestyle issue that we discussed before with diabetes. So it's a degeneration of the lens, and it's directly related to you know, the degeneration or the aging of your body. So if you have a healthy lifestyle, then the cataract will come on much later. The patients that I see that have sort of early cataracts, they're usually related to sort of unhealthy lifestyle, you know, lots of alcohol, lots of smoking, neglecting their body, their general health in general. So unfortunately, we still see quite a lot of that. So yeah, healthy lifestyle is the key.
How about like exposure to UV radiation, like people who are outdoors a lot? Are they kind of more susceptible?
Yes. So it's been
like,
confirmed that it's been confirmed that, you know, UV radiation
Yeah.
does cause your lens to age a lot quicker. So if you're outdoors a lot, then make sure you wear good eyewear protection, you know, sunglasses with, you know, anti-UV on them. Yes.
Well, we'll probably talk a little bit more about what good sunglasses are later in this interview. But yeah,
That's right.
so UV protection.
We see a lot of those.
UV protection is very important. Okay, and so what about the cataract surgery process? I mean, just the idea of having surgery on my eyes is not something that I want to think too much about.
Yeah.
But I have heard that it's pretty routine and fairly, you know, straightforward. I mean, what's your advice on that?
The cataract surgery process is quite a sort of a straightforward operation. So it is an operation. It involves a bit of a incision or a cut on, you know, on the limbus, or, you know, where the color part and the white part of your eye meet. So a bit of a cut. So when do people need cataract surgery? Well, basically when it starts affecting the lifestyle. So we discuss with patients about the lifestyle, you know, asking them how the vision is affecting them, and also focusing on whether the vision is still good enough for driving according to VisionPro standard. So if someone's vision is below the legal driving limit, then we will have a very serious discussion about getting surgery, because you know, it's first of all dangerous for the patient and the other road users, and is illegal. So, you know, they can get in a lot of legal trouble if they don't do something about it. So a lot of time we refer patients for surgery. There are two ways. You can go public or you can go private. Of course, private is much quicker. You can sort of choose your eye specialist who you want to see and who will do the operation on you. Public hospital, the eye and ear hospital, and other affiliated hospital with the eye and ear around the surrounding suburbs do take public patients. There is no cost, but the waiting list is quite long, and you don't get to choose your doctor or your eye specialist. So we tell patient all that, you know, we give them the options, and, you know, in the end it's up to the patients. But the procedure, the cataract surgery procedure is quite a straightforward procedure. usually you go in the morning and then by noon you're discharged to go home.
It's with a local anesthetic, is it?
Yeah, it's just a local anesthetic. You don't go to sleep. You're wide awake when the doctor performs the surgery. But yeah, you just don't feel any pain. Maybe a few.
And like how quickly do people notice like improvements in their vision after they have cataract surgery? Is it usually immediate, like, or is it the next day or next week, or when should they expect
Well,
to see a difference in their
usually,
vision?
usually you go home with an eye patch, and the next day, or usually within the next 2 3 days, you go back to see the doctor to remove the eye patch, and you can probably see maybe 80 90% of perfect vision if your vision is not affected by anything else, and if the surgery went successful. Now I say that because in a very small number of cases, I'm talking about maybe 2 3%. There might be complications with the surgery, but that's very rare. So within the first few days, you'll be able to see quite clearly.
Okay.
You will be given eye drops just to sort of stop any risk of infections, to help the wounds heal quicker. So you'll be on drops for a few weeks, and after 6 weeks, then you're ready to have another eye exam, eye measurement to get new glasses, because your prescription will change completely after your cataract operation.
And do they usually do both eyes at the same time, or do they do one eye at a time? The ophthalmologist, do they operate on one eye at a time?
Yeah, they won't do two eyes in the one surgery. They usually do the worst eye first.
Yeah.
And what I see usually is the other eye, the better eye doesn't need surgery maybe until 1 or 2 years later.
Okay.
In some cases, the patient can see quite well after the first surgery, that they don't really feel like they need a second surgery. But if they want to, they can have it done, after 2 3 months, after 6 months, after a year. It's really up to them. But yeah, it doesn't usually happen at the same time. No.
Okay. Yeah, my father's due to go in for cataract surgery, and his optometrist is telling him that after he has it, he'll be able to see things he hasn't seen in years. So he's probably pretty excited
That's
about
true.
that.
That's true. I get a lot of comment from patients who just had surgery saying, "My God, I can see like when I was young. I see
Right.
everything very clearly. I can see, hair on my face and stuff like that."
Yeah, it's like getting a new set of eyes again.
Yeah.
So okay, so we've talked about vision for the elderly. So let's switch gears a little bit. Let's talk about eye care for children, for youngsters. So like parents, I'm a parent, but most parents are very aware that good vision is important for their children, especially through the academic years. So what are some common signs that a child might be struggling with their vision? Like, how can parents maybe spot that they need to bring their kid in to see you?
Well, sometimes the child might not tell the parents about them not being able to see, or any sort of issue with their eyes. So as a parent, we need to sort of look out for any signs, anything that might raise any sort of vision questions. So things like if they squinting when they looking at the iPad or watching the TV, or they tend to come and sit very close to the TV, or if they rub their eyes a lot, because sometimes when a child can't see well, the natural tendency is just to try and rub their eye and try and see better. Or even things like they avoid sort of reading because it's so uncomfortable trying to focus on the words on the page, because they might have a high prescription that is not corrected. Or sometimes parents can actually look at their child and and see that their eyes are not straight. You know, one eye is looking straight, the other one is looking inward or outward. So that's a squint. So those are the things. But usually, before they start, you know, 4-year-old kinder or prep, we would like to see them. We get a lot of referrals from school nurses. You know, the nurses go to the school and do sort of a screening vision test, and if they notice any reduced vision or any issues, then they will give the parent a referral to take the child to come to us for a thorough full eye examination. And that usually happens in prep, or you know, sometimes we see children at 4 years of age with a referral, so that means they're still in sort of kindergarten.
Well, I know, you see a lot of children there in your practices. I had an eye test myself a few weeks ago, and it's the standard thing where you got to read the letters from the bottom line as best you can. But like in the case of a lot of very young kids, like maybe they don't know their alphabets well yet. So I imagine that the eye tests for kids are in many ways different to eye tests for adults. So can you tell us a little bit more about that?
Yes, sure. So we always try letters and numbers first, and usually we find that they know numbers from 1 to 10. But if they can't read letters or numbers, then we have pictures that we can show them, and we have a method which we show them a letter, and they don't have to know the letter, they just have to look at it and try to point to a matching letter on a book in front of them. So that works quite well. That works quite well. So assessing their vision is the most important thing that we do. Assessing their eye movement, so their ocular excursions, their sort of prescription. Now, it's a bit of a challenge to measure a prescription in a trial, so we have special methods where they don't need to tell us anything. We don't need to ask them any questions. We just need to put a special drop in their eyes, and we use that method to measure their prescription. We also check for any squint, any allergy. A lot of young kids in Australia have allergy, and that often involve ocular allergy. So yeah, I must admit it's more challenging testing a kid compared to an adult for obvious reasons. Yeah. But we see a lot of kids in our two clinics in St Albans and Footscray. Yeah.
Well, we talked a little bit before when we were discussing diabetic retinopathy about how lifestyles do have an impact on our health and on our vision, and I think that what I'm hearing a lot of is that short-sightedness in children is becoming more and more of an issue, and a lot of people are saying, this is also related to lifestyles. Kids having too much screen time, not enough green time, I feel like, not enough time outdoors, playing in an outdoors environment. So is myopia, I think is the proper word for short-sightedness or nearsightedness. Is myopia something that you're seeing more and more of in your clinics?
Yes. So short-sightedness, or being short-sighted where you can't see far, or myopia, is a very, very prevalent condition worldwide. In fact, it's estimated by 2050, close to sort of 40 or 50% of the world population will be short-sighted. In some countries like Taiwan or Singapore, close to 70-80% of people are short-sighted. And yes, we have seen an increase in number of young children becoming more and more short-sighted. And I definitely think it's related to lifestyle, with the habit of looking at phones, looking at devices, playing games. A lot of kids now spend a lot of time on devices,
I know.
and it's directly related to myopia. So myopia is a multifactorial problem. So it has many factors that affect or it causes myopia. One of the main factor is near work, near viewing. So if you do a lot of near looking devices, phone, then your chance of becoming short-sighted is very, very high. Yeah, so as one of the ways to manage or control myopia, we always advise to reduce screen time and increase outdoor times to the kids and the parent.
Yeah.
But you are absolutely right. It is an increasing problem. We do see that in our practice.
Well, yeah, on top of like lifestyle adjustments and environmental adjustments, I think that there are also some new eyewear technologies that have been released or have become more popular in recent years, aren't there? Like ortho
Yes,
K
that's
is
right.
one example, orthokeratology. There are myopia control glasses now that are on the market. But I know that one that is becoming more and more popular in Australia is special contact lenses, soft contact lenses that have like an inbuilt myopia control feature to them. I think
That's right. Yes.
MiSight is the brand, isn't it? So can you tell us more
Yes.
about what MiSight lenses are and how they help with myopia?
So short-sighted, or if you are highly short-sighted, then you are at a high risk of having eye health issues.
Mm-hmm.
For example, people who are highly short-sighted have an increased risk of glaucoma, an increased risk of retinopathy, for example, retinal detachment. So you will want to try to control your myopia. You don't want to become too short-sighted. So that's what we try to do with our patient. We try to manage or control their myopia. And we do that from a very young age because it has been shown that it sort of only works well if you're sort of under 18. Not many studies have been done on people over 18, but I guess by that age and onwards, your system, your visual system, and your neural system is all set. So it's very hard to manipulate. So the methods of sort of controlling myopia is first of all, you can wear special spectacle lenses. So it's like your normal pair of glasses, but it's designed very smartly in a way that it slow down the increase of your prescription of your short-sightedness. So they've done a study where they take thousands of people and put them into they're in the age of from 8 to 13, put them into these lenses compared to the same number of children with just sort of standard short-sighted lenses. And over a few years, they find that the children wearing what we call the treatment lenses, the increase in their short-sightedness is 50% less than the other group. So that's special spectacle lenses. What we do a lot in our practice is we combine the wearing of the special treatment lenses with an eye drop. So you can get an eye drop and you use it once a day. It's a very low dose, low concentration, so it doesn't affect your vision. But in the long term, it's been shown to also slow down the increase of myopia. Children who are a little bit older and can handle contact lenses, then we present the option of wearing soft contact lenses to them. It's a soft contact lens, so it's worn from morning till night when they get home from school. So it's called one of the main one on the market at the moment is called MiSight. It's a myopia control design contact lens, and it also has been shown to slow down the increase of myopia by around 50% for the people or the children that wore those lenses. So those are the three treatment options that we have, and we are increasing that sort of treatment in our practice in the last couple of years.
And so the MiSight lenses, you said they are soft lenses. So I know that there are like basically two kinds of lenses. There's the soft lenses and the hard lenses, or what are they called? Rigid gas permeable lenses, which I think a lot of people find that it can be a bit challenging to wear. But with the soft contact,
right, yes.
with soft contact lenses, it's just like a soft piece of plastic just fits on your eye, and you don't even notice it. So I guess that's a lot more manageable for a lot of kids, isn't it?
Yes, that's right. I mean, a lot of people out there wear soft contact lenses, adults, for sport and things like that, or people who wear soft color contact lenses. But these soft or the clear soft contact lenses are far more comfortable than the colored soft contact lenses. So I'm talking about the clear soft contact lenses. They're quite comfortable. Their design have sort of become very advanced over the years, and I mean I wear soft contact lenses most days of the week, and I don't feel them. You don't feel them in your eyes anymore. So basically, as soon as we feel that the child is ready to handle the lenses by themselves, 8, 9, 10 years old, we can think about starting. Just a matter of sort of them put them in, take them out. That's it. We train them, we let them practice, and if they can do that, then they can wear the lenses. And the lenses that I mentioned, the MiSight, is a daily disposable. So every day is a fresh new pair. There's no maintenance, there's no cleaning, there's no storing overnight. It's very convenient. It's very comfortable because it's a fresh new lens, and being a fresh new lens, the risk of infection is minimal.
Yeah, I remember, like, as an adult, when I started wearing contact lenses, I did have to get into the routine of cleaning them properly every night and storing them and the disinfectant every night. But then later I switched to daily disposables, and it's like I wouldn't go back. Just the ease and the convenience, and like you said, the hygiene benefits of just putting in a fresh pair of contact lenses every day and then throwing them in the garbage at the end of the day. It's just very easy, and I think it's probably something that would address some concerns that parents may have about whether or not their kids are going to be mature enough to handle the cleaning responsibilities. So with MiSight lenses, they don't need to worry about any of that, do they?
That's right. Yes. So it's very convenient.
Yeah. Well, you mentioned that you have that you also offer lenses there, spectacle lenses for myopia control. So I've got a nephew actually, and he is wearing it's MyoSmart, isn't it? Are they MyoSmart? I know there are probably a few different brands on the market anyway, but he has those spectacle control lenses. But the first pair of frames that he had, they didn't last too long because being a kid, he has a rough and tumble lifestyle, and he upgraded to a better set of kids frames, Nike kids frames, I think they are, and they're perfect for him now. So maybe that's a good segue for us to talk about designer frames and like high quality spectacle frames. Why might somebody choose to pay a bit more for designer frames over just the cheapest, bottom of the range brands? Like, what are some of the benefits that you get from actually investing a little more in quality eyewear?
Well, obviously the first thing is the quality of the frame. So they tend to be of excellent quality. So they will last you a lot longer. The material, from the material to the hinges, the nose pads, they last longer. And secondly, the style, the appearance of them. So now they're being designer brands. Obviously, a lot of effort and time has gone into the design of a particular style, a particular model. And it's produced for most of the designer brand frames that we sell, produced in either Italy, France, or Japan. And as well as being a corrective lenses, a pair of glasses is a fashion item. So, people who are sort of appearance conscious, fashion conscious, they always go for a designer brand frame. So we sell a lot of that in our two stores in St Albans and Footscray. And most of our frames are designer frames. Most of them. We also have sort of a mid-range and a small budget frame. So basically, we cater for all ages or preferences or styles. Yes.
Yeah. So I hear people talking about building up their eyewear wardrobe. And when I first heard that phrase, eyewear wardrobe, it actually made a lot of sense to me because most of us, we wouldn't walk around with the same shirt on every day in every situation. Sometimes we need certain clothing for work, sometimes for social events, and I think maybe eyewear is a lot. There are some parallels there. Sometimes you want a certain aesthetic for work, and then another aesthetic for when you're socializing. And I guess all of those same kind of benefits that we talked about, like the high quality, the better quality frames and materials, that applies equally for like spectacles and sunglasses, doesn't it?
Yes, for sure. Most brands will have an optical range and then a sunglasses range. Most brands are like that. And the quality will reflect in the brand, in the manufacturer, in the designer house that sort of come out with these products. We carry a very wide range of the latest sunglasses brand, especially sort of coming up into the warmer months, the summer now. Being where we are in St Albans and Footscray, we find that our sort of patient demographics, they prefer a nice pair of design sunglasses. When they go on holiday, they in sort of holiday mood, they just want to enjoy themselves, look nice, wear nice clothes, wear nice sunglasses. But also the lenses that come in those designer frames are good quality lenses with, like I mentioned before, UV protection that protect your eyes from the harmful UV rays. And that's has become very, very, very popular because, we are all sort of very health conscious. We want to do everything we can to best protect our body, our eyes. So it's both. It's basically a fashion, a lifestyle item, as well as a benefits for your health. So it all makes sense.
Something that I'm learning about as I speak with more and more eye care professionals is that all lenses are not the same. Like, obviously with sunglasses, you've got that. Well, actually, I think most lenses in Australia now have UV protection built in, don't they?
That's right.
Like
Yes.
even non-sunglasses have some sort of UV protection built in. But there are now all kinds of coatings that we can get on our lenses, aren't there? Like anti-glare, like
anti-glare coating,
anti-polarization, anti-fog lenses. There's a lot of different additional multi-coatings that you can get to actually enhance your lenses even more than you would get in a cheaper product. Is that right?
Yes, that's right. So anti-reflection coating or standard, in either optical lenses or sunglass lenses. But when I say standard, I mean standard as in the patient have to want to have to sort of pay for it. But we rarely get anyone asking not to have anti-reflection or multi-coating on the lenses anymore. So it's become like a standard feature of the lens now. For sunglasses, yes, most sunglasses, most designer brand will have an anti-reflection coating on the lenses. So when you wear those sunglasses, you know, when you look out of them, it feels very, very calm, you know, very, very easy on the eyes, if you like. Especially, you know, when you're in a situation where you got the sun directly shining into your eyes for driving, for example. But there are there are certain lines, certain brands that are designed for driving. We call them drive wear, and they even offer more comfort, more protection when you're driving. And you know, the final sort of group is the polarized lenses. So they're very sort of comforting to wear. They're very good for reflected light. For example, when you're on the water, you know, when you're on a boat going fishing, or when you're skiing, there's a lot of reflection from the surface of the water, the surface of the ski or the snow. So you get very, very comfort, good protection from those polarized lenses. So they are becoming very, very popular. I get a lot of patients buying them just for driving in summer. Yeah.
And I think it's also possible to even get like a subtle tint in your lenses, isn't it? Like I don't know if you're a golfer. I'm certainly not, but I've heard that some avid golfers even like to get a slight green tint in their lenses because it helps them to like see the contours of the course a little better. So I don't know if that's something that might be popular for some people.
Certain brands have you know, certain models for golf.
Yeah.
So the lens come in a certain tinge that when you're on a golf course, it sort of makes everything a bit brighter and clearer. Yep. So you know, you don't miss you don't miss your green.
Yeah.
I do play a little bit of golf myself, so I wear a pair of those. Yes, but you're right. Certain brand will sort of make them just for golf, but you can certainly get tints to help you with that when you're on a golf course. So yeah, if you play golf and you want a good pair of sunglasses that help you improve your handicap, then yeah, come and speak to us.
There you go, guys. So an easy hack to increase your or improve your golf handicap is upgrade those sunglasses. All right. Well, we might wrap it up there, Min. So this has been a really you know, informative interview. Is there anything else that you wanted to add before we go?
Like I said, you know, I mentioned before, we have two stores, one in St. Albans and one in Footscray. Early next year, we're going to open our third VisionPro optometrist store in Sunshine. So we are a full scope comprehensive optometry practice. So we see, you know, patients of all ages. We offer a very wide range of quality eyewear products, designer frames, quality lenses, including sunglasses lenses. And we have the sort of the latest equipment and technology in our testing room to make sure that we look after the health of your eyes well, and we do a lot of management of myopia for the young children. So if you know, if you're looking for good quality eye care and quality eyewear, yeah, come and speak to us. You can find us at www.visionpros visionpros with an s .com.au, or you can get in touch with us. Our St. Albans store is 039364 5509, or our Footscray store 039687 8787, or on Facebook. You can go to VisionPro Optometrist, and you can find us on Facebook.
Right, excellent. Okay, well, guys, so if you've been watching this and you find this content helpful, don't forget to hit the like button on YouTube, because it really helps us in the YouTube algorithm. And also hit the subscribe button if you'd like to be notified when Min releases more highly valuable YouTube videos like this one. All right, well, so thanks a lot, Min.
Thank you, Paul.
All
Thanks for
right,
having me. Cheers. Bye-bye.
goodbye, everyone. Have a great day.